YouTube channel Ayurveda Basking. So today video is very special and it is for the Swasta practical exam according to our NCSM pattern, and in this video we will go to all the portion that is given. As you see the PPT I have prepared, in this I have added all the portions that is given for your exam. Along with that I have added the essential portion for Viva also. Like in Swasta the main things is that there are so many definitions, so some of the definition I have added and the other I will share later in the Telegram channel. Here I added all the definition according to the WHO consideration, and along with that in this paper actually we have basically 5 main division. In that one is yoga portion is there, that is for your 20 marks. Okay, and total this was the practical is basically for 200 marks, out of which 5 portions are there. We have to cover 5 portions for getting marks out of this 200. First portion is your yoga, in which you have got 20 marks. Second and third portion is basically your written exam. For this written exam 70 total marks are given, and in that 2 subdivision are there. And the best things of today video is that I have written all the key essential point regarding with this written exam, because sometimes like we can't think that much in examination, so what to write, the preventive care or other things. So in this video I have written all the things that can ask from this 70 marks portion. After that you have your fourth portion. Fourth portion is basically your Viva, and along with that fifth portion is your practical record. So practical record is basically for 10 marks, and this Viva is subdivided into first part is Viva on your activity book, because as you know in Swastha we have submitted our record. Along with that we have submitted one activity book. For 10 marks Viva is there from that activity book, and 60 marks Viva is there. So total is 60 marks Viva will be there, 10 marks for your activity book and 50 for your syllabus like paper 1 and paper 2, 25 marks for paper 1 and 25 marks for paper 2. So here I will write all this thing. For yoga you have total 20 marks, then for written exam you have total 70 marks. Okay, then comes your record will carry your 10 marks. Then Viva is carrying total 60 marks. Out of this 10 marks is from that activity books and 50 marks from paper 1 and paper 2, like so 25 marks from paper 1 and 25 marks from paper 2, and the last portion or your elective. So all this constitute the 200 marks, and in this video we are going to discuss how we can get maximum marks out of this 200, because as you see our Swasta paper is over, and some like a Swasta paper is somewhat moderate level. So in our Viva we can perform better so that we can get maximum marks. So let's start our video. As you see in our video, first portion is yoga. So let's start with the yoga portion, and I have marked here important things also. Okay, so first of all you have to understand that this yoga portion is constituted only the 20 marks portion. Okay, so don't be panic about this portion. Okay, and you know there are very less things you have to do, so you can easily do. First of all there is 2 portion, asana and 1 pranayama or shatkarma. Okay, so every person have to do at least 4 asana, along with that 1 pranayama or 1 shatkarma. So asana is basically we have total 8 asana. 2 are your standing asana, 2 is sitting, 2 is supine and like lying position supine, and 2 lying position prone position. So I have marks like Trikonasana, Ardhakati Chakrasana is standing asana, Gomukhasana and Bhadrasana is sitting asana, Pavan Muktasana and Sarvangasana is lying in supine position, then Bhujang and Shalabhasana is lying but in prone position. So these are the only 8 asana you have to do for your practical. Out of this 8 you have to perform 4 asana, maybe 1 sitting, 1 standing, 1 prone, like that, or maybe chit system will be there. You have to pick up the chit, and which is written on that chit you can do that asana. Then one important thing is there, for each asana constitute only 4 marks. So 4 marks have a mark distribution, and this is that 1 marks for the procedure, you have to correctly do the procedure. Second marks is for the final posture holding, like in Bhadrasana we have to hold that posture, or in Trikonasana the final posture we have to hold for 5 seconds or 10 seconds, so that the examiner can evaluate, oh you know that final posture of that particular asana. Then the third marks is for the breathing pattern, when we have to inhale, when we have to exhale. And the last 1 marks is for the Viva, if he can ask you the contraindication or the benefit, like that. So each asana constitutes the 4 marks, and this is the mark distribution. If you perform any asana and you miss one of the part of this, then you can get 3 or 2 marks out of this 4 marks. So 4 asana into 4 means 16 marks you will getting for this asana. Then 1 pranama or shatkarma you have to do, so that constitutes only and only 4 marks. And it also having only 5 things in pranayama. Nadi Shuddhi, as you know, Nadi Shuddhi and Surya Benda all are like almost similar, but in Nadi Shuddhi we have to start with inhaling through the left nostril, and in Surya Bedna we have to start from the right nostril, and we are using the same mudra, one hand in the Chinna mudra and second hand in the that Vishnu mudra. Okay, next is Shitali Pranama, Shitkari Pranama and Brahmari Pranama. So out of this 1 pranama they can ask, and if they don't asking you pranama, they can ask any shat karma among Neti and Kapal Bhati. So this is your mark distribution for this pranayama, and it also constitutes the 4 marks. So total 20 marks is there. And if you don't have the particular note for this, I will share one best PDF on the Telegram channel. In that you can see the all the asana with their correct procedure, and along with the mark, like this will come in the practical or this will come in the theory. So that PDF I will share on the Telegram, and I will add the PDF link into the description of this video. You can easily visit that PDF and you can start practicing that particular asana from that PDF given pattern, so you can score well in this asana portion. Okay, then second subheading basically constitute the next portion, and this is basically your written exam, and it constitute total 40 marks. Okay, so this is one of the major portion. Okay, and this 40 marks basically have 2 heading. First is the diet and lifestyle advice case sheet, that constitutes the 25 marks, and second is only the lifestyle advices, that constitute the 15 marks. And in that basically you have given one scenario, so that you have to give the diet according to that things. And here I have taken some of the some of the case scenarios, so that we can understand how we are going to attempt this question, so that we can get maximum 25 and minimum 20 marks out of this 25 marks. Okay, so let's see our first heading, that is diet and lifestyle advice case sheet. Here I have written one case scenario. A 35-year-old male school teacher, we have to start like marking, so that this portion you remember in your exam. A 35-year-old male school teacher visited the health center with complaint of indigestion. He is having the problem with digestion, indigestion, heaviness after meal, occasional constipation and tiredness. He has a sedentary occupation, so he is always like sitting habits or all the sedentary lifestyle he is following because of his occupation. He is having the irregular meal time and consume fried and spicy food frequently. Okay, so out of this you can easily examine what is the nidana of that condition. Now this is the feature that we have already know. Age is 35-year-old, sex is male, and occupation is school teacher but sedentary work. Prakriti is out of this Kapha Pitta. Agni Bala is because Manda Agni. As you see, he is taking irregular meal time and spicy, so all this hamper his Agni, and that is Mandagni. Bowel habit, he is almost constipated, and appetite is poor, that's why he is having the irregular meal timing, and physical activity is minimum. Like this you can make one chart, so that you can easily do the assessment, because our Ayurvedic assessment start with our Dashavida Pariksha, Ashtasthana Pariksha, so we have to examine according to that with the given information. Okay, first point is that. Okay, second point is that, so first point, as you know, all clear. Second point is assessment or identification. So we have assessed, like due to this sedentary lifestyle and all this, the person is having the Kapha and Pitta Prakriti. He is having the Mandagni. sedentary lifestyle he is following, and they are risk of Agni Manda. And whenever there is a Agni Manda, ama formation will be there. Actually, in every disease, ama is the main diseases, but due to Agni Manda, firstly ama will be formed, and it can lead to the metabolic imbalance. Okay, next is what we can give as a diet advice, or that is known as ahara chikitsa. So what is the principle of diet? We have to give him a light, warm or freshly prepared food. Okay, because as we know in that ahara vidhi vidhana we learn, like ushna, snigdha, this will good for our digestion. This guna is good for our digestion, and you have to take freshly prepared food. Avoid the stale food or refrigerated or processed food. Avoid the oily, fried, heavy and cold food, because as you know, this is the nidana for the Agni Manda. Food should be Agni Deepana and Ama Pachna, so that your Agni correction will be okay. And what will be the recommended diet chart? So here is the diet chart. First, what we have to take in morning breakfast, like that you will prepare the diet chart. In morning, prefer warm water with some drop of lemon, because it is good for this ama pachna and agni deepna. And optional, we can take ginger infusion. Then in breakfast, try some light meal like vegetable upma, oats porridge, or steamed vegetable or herbal tea. In mid morning, can have some fruits like seasonal fruit, papaya, apple or guava. In lunchtime, warm rice or wheat chapati, along with that any protein supplement, moong dal or masoor dal, cooked vegetable, bitter gourds, bottle gourd, rich gourds and carrot, buttermilk with roasted cumin. Because in our Ayurveda it is already told, after the food what will be the best we can consume is the buttermilk. It will enhance your Agni, because it is a amla rasa, and amla rasa is ruchya in property. And in evening, light snacks will be given like puffed rice, because that is lagu itself, and herbal tea. Avoid the milk tea. And in dinner, light and early dinner is good. And in our Ratri Charya, we have already studied, like night we have to take the food in the Pratham Pravahara Antara. Okay, and we have to take the light food that is easy to digest it. And we can take vegetable soup or khichdi, and avoid curd at night. That is mentioned in our Ayurveda. Food to avoid. Next is our apatya. What we should not have to consume is fried foods, spices, cold drink, heavy sweets. And lifestyle advices is a regular meal time is there, because that is very important for our proper digestion and proper functioning of the Agni. Avoid the day sleep. Light physical exercise will be good for the health. Practice yoga and pranayama according to the sohitya of the person and the time he have. Then Vajrasana after meal is good. Kapalbhati and Anulom Vilom is good. Then adequate sleep is required, because sleep is our healing and regeneration process. Avoid stress and overeating. Then avoid according to Prakriti. So he's having Kapha and Pitta Prakriti, so avoid Kapha increasing food, sweet, oily or heavy. And avoid Pitta precoping food like very spicy and sour. Prefer the bitter and acid, because this rasa will pacify both of this taste, both of this Prakriti dosha. Then advice according to Agni Bala, as he have a Manda Agni, so eat only when he is hungry, otherwise ama will be formed due to the atyashna or excessive eating. Avoid overeating. Take warm or easily digestible food. Use digestive spices. And what will be the health education? Importance of the balanced diet is very important. Role of Agni in digestion we know through this case sheet. And long term benefit of lifestyle modification, if person do proper modification according to the given case sheet. Then what will be the conclusion? A planned diet according to the age, Prakriti, Agni Bala and occupation, along with the lifestyle modification, will improve the digestion, prevent disease and promote the overall health. Then if you want maximum marks after 25, you can do this case sheet like in this pattern. First you have to analyze your case and assessment that carry the 5 marks. Then you have to give a very beautifully and very nicely diet plan that is considering 10 marks. Then for lifestyle advices 5 marks, Prakriti and Agni based justification 5 marks. So like this you can write your case very nicely. First do a proper assessment, then write the diet chart according to the timing of the day. After that you write the Patya and Patya, then according to Prakriti, according to the Bala, and lastly don't forget to write this conclusion, because it is giving you very nice presentation to your written exam. Then the second part of this second question is that advice on the lifestyle, and it is only the 15 marks. First is that ahara and lifestyle, both we have to give the advice. Here we have to give advice only on the lifestyle, and here lifestyle we have to include the brahma muhurta uttishtatam vyayama kavalam gandushta abhyanga. This heading we should have to include in our answer of the case scenario, and it constitute only and only 15 marks. Okay, so first is very important because that constitutes 25 marks. Next, let me start with this case scenario. A 40-year-old male office worker presented with the complaint of heaviness in the body, lethargy, indigestion, irregular sleep and weight gain. He has a sedentary lifestyle, irregular daily routines, late night sleep and minimum physical activity. Okay, so first we will evaluate all the assessment, like age is 40 years, occupation he is a office worker, prakriti is a kapha dominant due to he is having the property of weight gaining, heaviness, all this constitute the kapha. Then agni, since prakriti evaluation is a large domain, okay, we can't assess through this minimum information, but we have to assess according to our given conditions. Okay, agni bala is mandagni. Then assessment, the patient has improper dinacharya because he have a irregular sleep, he is late night sleep and minimum physical activity, and he is not doing the daily routine timely. So he is having a improper dinacharya, his physical activity is very much reduced, and all these things will lead to the kapha aggravation and also the hampering the digestive fire, that lead to the poor digestive fire of mandagni. So what are the lifestyle modification we can give to that patient is the first brahma muhurta of this state, wake up during in the early morning or before sunrise 4:30 to 5 a.m. Then what will be the benefit if he wake up at that time? That improve the digestion and metabolism, that enhance his activity, mental clarity and prevent the kapha accumulation, because when we wake up at late in the morning or in the kapha time, that can lead to tendency to increasing the kapha inside the body, and person will feel heaviness when he wake up late, because that is the kapha time. So we have to wake up before that time so that we don't feel that much heaviness in the body and kapha accumulation will be less or reduced in our body. Then what are the vyayama? A person has to do ardha shaktiya nishevyatu snigdham bhojani bhi. So a person have to do half of one's capacity daily moderate exercise, and the recommended things is brisk walking can be done, surya namaskar, and benefit is that it will reduce the kapha and medas, it will improve the agni and maintain the body weight. Then abhyanga, daily or alternate day abhyanga with the warm oil are very good things, because abhyanga is having the property of jara shram vataha, and you can use sesame oil or triphala oil for this abhyanga, and its benefit is improve circulation, it will give good complexion to your skin, it will reduce the fatigueness and nourishes your muscle and skin. Then udvartana is the dry powder massage, you can do with the kolikulthadi churna or triphala churna. So it will help to reduce the kapha and medas, and also it will improve the skin texture and prevent the obesity, because it is having the effect on the excess medas and kapha. Kavala and Gandusha is basically oil pulling and gargling. In Kavala we have to do movement, but in Gandusha no movement will be there. And with this practice you can use the warm sesame oil, and it will help to improve your oral hygiene, because orally we are doing this practice, and it will prevent the dental diseases. Along with that, it will strengthen your jaw and voice improvement. Then Patimash Nashya, we have to use 2 drops of Anutela or sesame oil with each nostril. It will promote the ENT, Jatru Urdhva Vikara. Along with that, improve the breathing and enhance the immunity of the respiratory tract. Then the Sanana, as you know Sanana importance in our day life. So take bath with the warm water after Abhyanga. If you have massaged so many Abhyanga tela, then you can wash your body with soap or any kashaya you can use. Then avoid the cold water head bath, and avoid also the warm head bath, because that is not good for your eyes. Then benefit is it refresh your body, remove the fatigue. Nidra is sleep. Proper sleep is very important, because as you know Nidra is one of the Traya Upastambha. So sleep early at night, and so if you sleep early at night you can easily wake up in the morning. Simple. Avoid day sleep because according to Acharya Charka it will aggravate your kapha and pitta. Then a benefit is maintain your dosha balance and it will give you mental health, improve mental health. Ahara Vihara Samyoga is avoid the overeating. Follow the regular meal timing. Do not sleep immediately after the meal because it will produce heaviness in the body and it will hamper your Agni and that can lead to indigestion and all other problems. Health education is importance of daily routine is very important. Then role of Vyayama and avoid the sedentary habits. Then what is the conclusion? Following proper Ayurvedic lifestyle measure like Brahma Muhurta, Uttishthetam, Vyayama, Abhyanga, Udvartana, Kabla Gandusha, a person can maintain his health, improve the Agni, balances his three doshas or mental Rajas or Tamas dosha, and along with that prevent the lifestyle disorder. That is a very important things. Okay, so for this 15 marks, what will be the mark distribution so you can get the maximum marks? First you have to analyze your case that we have written here, like assessment of case. Like that, first you have to assess your case, and after the assessing the case you have to write the lifestyle measure that is given according to Dinacharya or Ritucharya. Along with that you can write the Ritucharya measure. You should avoid the Ritucharya. You have to follow the proper Ritucharya that is given, and for that you have to follow the Ritu Sandhi and Vega Dharana. Okay, you can add this essential point of Vega Dharana. Do not suppress or expel forcefully your Vega. And conclusion you can write, so it will complete your all the points mentioning in the question. So this written exam first point is covered in 40 marks and it is having two parts. Then third portion is that it is also the written part but it's having the different level. For example, there will be the 4 major things is given and it is totally of 30 marks. Okay, and 4 main heading is disinfection, communicable diseases, environmental health, non-communicable diseases. I will share this PPT and I will share the link into the description, so you can see here I have written like 5 or 7 cases per heading, so you can see that, and in video we will going to analyze one case per each. Okay, so first is the disinfection. We have to identify, we have to give the proper dose, suitability, dilution and contact period. So after that you can see here is the problem based case scenario I have written. Case scenario is that after the heavy rainfall, a village well is flooded with the dirty water. Using this water, start the complication of diarrhea and vomiting. Immediate disinfection of the drinking water is required. So identification first is that the water is contaminated. Okay. Second point is that when water is contaminated, there is a chance of the waterborne diseases. Then you can write the some of the example of the waterborne diseases. Then the suitable disinfectant is a bleaching powder in which chlorine is there, and the dose is 2 to 5 milligram per liter of chlorine. Dilution is 1 gram of bleaching powder will give 33% of available chlorine in 1000 liter of water. Suitability is drinking water disinfection is can easily disinfected by this process, and contact period is 30 minutes. Expected result is freeze the residue chlorine of 0.5 milligram per liter. So this is the accurate answer you can write in this kind of case scenario. Second case scenario I have written for the cholera patient, and you can see from this PPT I will share this. Third is for the disinfection of the hospital floors. Fourth is the disinfection of the skin before injection, and the fifth one is disinfection of the soil. Okay, next disinfection of the instruments. So like this you can write in your exam. And then how to write in exam so score maximum is, start with the identification, name the disinfection properly, and if you know the chemical formula just write it. Write the dose, dilution, suitability, contact period clearly. That should be clearly without any confusion, and use tablets or bullets points so that examiner know, oh you know these points. Okay, second portion is out of this second subheading is communicable diseases. So here I have written some case scenario like that the disinfectant. We will discuss the one case scenario. I will share the PPT, you can see or learn from that. The first case scenario in communicable disease I have taken for cholera. After a village festival, many people develop sudden onset of profuse watery diarrhea, and you know watery diarrhea is a characteristic feature of this cholera. Vomiting, dehydration. The common source of drinking water is contaminated, that is open well. So disease identified as cholera. Preventive measure is safe drinking water. You have to purify that water, chlorination, and proper sanitation and sewage disposal is important. Hand washing with the soap, early detection and treatment with the ORS, health education on hygiene. Same after that I have written for tuberculosis. So these are the all major. If in a particular disease you identified a vaccine is needed, then you can write that vaccination schedule of that particular disease also. Okay, then third is the measles, then malaria, dengue fever, typhoid fever, hepatitis A, chicken pox. And what is the exam tip for this? Always identify the disease clearly with the clinical features and all. Write at least 5 preventing measures and link the mode of transmission, like why we are doing this as a prevention, because it can lead to this kind of mode of transmission, direct or indirect. All those points you can add, and you can write the type of prevention if you well know that things, and use a simple and clear language. Third heading is environmental health. So environmental health is here also I have written 4 or I think 5 case scenario. Out of this you can learn this, and this all the 3 heading constant 15 marks. So question may be come from disinfectant, it can come from communicable disease, or can come from the environmental health. Total 15 marks will be there for part A of the third question. So first case scenario is for the water pollution. A rural community depend on a nearby river for drinking, bathing and washing the clothes. Over the past few months, untreated sewage and water waste from the nearby houses are discharged into the river. Many villagers have developed diarrhea, vomiting and skin infection. So obviously from all these symptoms we can clearly identify it is case of the water pollution. What are the preventive measures? So, first of all, treatment of the drinking water. So you can write all the treatment that we can do for a treatment for this, like filtration or chlorination. Then proper sewage disposal so that it will not mix in with your potable water. Preventive of the open defecation, that should be prevented. Regular monitoring of the water quality, health education of the safe water practice, and enforcement of the water pollution control law. Okay, second case is for the air pollution, and all the preventive measure I have written. Or the important point you can add is along with that, if you know any act or enforcement or any prevention control, you can write along with this whole thing. Third case is for the solid water pollution, fourth for the soil pollution, and fifth for the noise pollution. So how you can score 15 marks? You can write 2 or 3 case scenario if particular scenario is not given, and if particular scenario is given, then you identify the environmental health problem very nicely, accurately. Write 6 at least preventive control measure and write the heading and the bullet point. Second portion of this subheading is the non-communicable diseases, and in this non-communicable disease, first I have written the case scenario for the diabetes mellitus. So 52-year-old complained of excessive thirst, frequent urination, increased appetite and weight loss. He led a sedentary lifestyle and has a family history of similar illness. So disease identifies diabetes mellitus. Preventive and control measure is health balanced diet. Then you can write the balanced diet, but you can give patha or patha according to Ayurveda, you can also include. Then reduce the sugar and the fat intake. Regular physical exercise is necessary. Maintain an ideal body weight. Regular blood sugar screening is important. Avoidance of the smoking and the alcohol. Complaints with the medications with the regular follow. Second I have taken for hypertension. Third for CAD, coronary heart diseases and all. And next come the iron deficiency, anemia, and vitamin deficiency, iron deficiency. Okay, here actually that is repeated. Okay, so for the deficiency diseases, here I have taken some vitamin deficiency and all that can also come in exams. Okay, so first I have taken for vitamin A deficiency. A 5-year-old child has a difficulty in seeing in the dim light and dryness of the eyes. The mother reported the child rarely eats the fruit, vegetable or milk. So obviously it is the case of the vitamin A deficiency, that is night blindness. So recommended nutrient is vitamin A, and you can write the RDA of that particular vitamin or the sources properly. Okay, so function of the vitamin A is maintain the normal vision, it maintain the healthy skin and mucous membrane, it will improve your immunity, and the dietary source carrot, pumpkin, leafy vegetable and others also you can add. Then prevention is vitamin A supplementations is there. Then balanced diet rich in vitamin A, and for the small children vitamin A prophylaxis can be given. Second, for iron deficiency anemia I have written. Third is iron deficiency. Then PAN I have written for this protein energy malnutrition, Kwashiorkor and Marasmus. So you can see from our this PPT, I will upload it. And vitamin C deficiency, vitamin D deficiency, and these are the exam tip you can follow. Next come so this is the third subheading that constitutes only 30 marks, 15 marks, 15 marks. Okay, fourth subheading is basically for your practical record, and that will constitute the 10 marks. I hope you all have completed your practical record of Swasta, so that is basically for 10 marks you will get from that record. And the fifth one is the Viva, and Viva is having basically two subheading. First is the Viva on the project work, that is your activity book. So first Viva is on your activity book, that counts to 10 marks, and the second Viva is basically your theory paper, paper 1 and paper 2. So this all are the heading that is asked for the exam, and here I am going to mark some of the important things. The shloka also you can remember, definition of swastha and swastha, along with that health dimensions. Okay, objective and subjective component. This dincharya measures all are important, they can ask anyone, so you study all this one. Then definition of nidra, type of nidra, definition of brahmacharya and all. Then ritu sandhi, yama damshtra, dharniya and adharniya vega, definition of sadvritta, achar rasayana in ahara, importance of your ahara, classification of the food, ahara sevana kala, ashta ahara vidhi vidhana, dvadam shasana, that is important core topic given. Preferably you can remember the shloka of this nitya sevaniya ahara dravya. You try to remember the shloka of nitya sevaniya ahara dravya, because syllabus is saying this thing directly to you. Okay, then next things is that meaning of pathya, samashna, this is very small topic, samashna, dhyasna, vyashamasna. Then source and deficiency of nutrient like vitamins and mineral, pasteurization of milk, this is actually DK topic, but you should learn it, maybe they can ask you. Then definition of nutrogenomic nutraceutics, that is also I think DK or something NK. And viruddha ahara, that is MK topic. Okay, then definition of the rasayana and antioxidant with example. So this ahara portion will constitute 10 marks, and the above two headings is 2 marks. Next comes the yoga. Again in yoga, all the definition of this ashtanga yoga, like yama, niyama, asana, pranayama, pratyahara. Then shat karma list out and indications along with the benefit and all. And here one of the important thing again, in Shat Karma and indication you try to learn the shloka. Okay, and in Ashtanga yoga also try to learn the shloka, that is very good for you. Okay, type of bandha, that you just learn the matter itself. Next come the this Shat Chakra and difference between Sukshmna, Pingala or Ida Nadi, definition of moksha, mukta, atma, lakshana, moksha upaya, this you can just learn the matter. And then here the naturopathy basic principle, type of fasting, like types also very important. Second paper is basically first of all meaning and causes of Janapadodamsa, then the definition, that is a very like hectic work, because in second paper mainly more and more definition are there. So definitions of term related with the epidemiology and infectious disease, then dynamic of the disease transmission, immunizing agent and immunization schedule. This term you just see at least once, because sometimes we can't even think at that Viva time what a teacher is asking. Okay, definition of Vyadhi Shamatva, causative organism and preventile measure of the communicable disease, primary, secondary, tertiary, all those. Then composition of air, very basic, but you should remember this. Definition of comfort zone, ventilation, type, definition of safe and wholesome water, source and type of water, purification water of the water as per Ayurveda and contemporary. Then next definition of occupational health, And after that, listing out the occupational hazard and disease, ESI Act and Family Act. So factory and ESI Act is important here. And the health problem of the school children. In the school health problem, he is only asking the health problem that is facing by the children, that all 5 point, I think that malnutrition, diseases of the eye, ear, all you have to say. Then definition of different terms related with the disinfection, like sterilization, asepsis, bacteriostatic, bactericidal, type and agent of disinfection. That is very important things. Okay, then definition of the primary health care, very important. Along with that, the function and population coverage of subcenter, PSC and CHC. Then objective and problem indicator of MCH, definition of family planning and eligible couple and the target couple. After that, this definition of geriatric, problem of the age, and WHO, headquarters and main function of international health agencies, and year of establishment. After that, the last portion is that the elective will constitute only 10 marks. Internal assessment for first, second or third term constitute the 30 marks. So total will be the 200 marks. When you got this PPT, you can see here some of the terminology I have added. Like these are the definitions that we generally confuse. So I will mark here. This is the terminology for this epidemiology portion, like infection, contamination, infestations, host, communicable disease, epidemic, endemic, pandemic, zoonosis, eradication, carrier. Then concept of prevention, I have written the essential definition here, and what is the concept of prevention, along with that primordial, primary, secondary and tertiary. Then WHO definition for this disaster. This is very important definition. Along with that, a classification of disaster, composition of air, ventilation, then type of ventilation, comfort zone definition. Along with that, a comfort zone that is evaluated in India, safe and wholesome water. Along with that, a type and source of water according to modern as well as from the Ayurveda perspective. Solid waste include the solid waste definition, type of the waste. Then comes the occupational health, and along with this hazardous and the diseases, and this dust and all, you just study this whole portion. Next is the ESI Act and Factory Act. The key lines or the meaningful things I have mentioned about this ESI Act and the Factory Act. Then disinfection, the definition, the other terms that is generally used in case of disinfection. Along with that, its type, concurrent, terminal, precurrent, and the disinfectant type, like natural agent, physical and chemical agent. After that, this dynamic of the disease transmission, that include only 3 main things: reservoir or source of infection, mode of transmission, susceptible host, and immunizing agent, this vaccine, immunoglobulin or antisera. Then this PHC definition, principle of PHC, element of PHC. Then the level of healthcare, village level, we have this subcenter, PHC and CHC, and it is that population coverage of this various area. Then demography definition, and it is basically having 5 main things: fertility, mortality, marriage, migration and social mobility. Then family planning definition, it is a big definition but try to learn it. Then maternal and child health program, actually it is not as a 5 marks portion in the theory paper, but is given as a heading for this Viva, so it can ask. Then contraceptive methods, definition of preventive, geriatric and the problem facing by them. Then WHO introduction, all I have written here, all the headquarters and the objective, principles, along with that the structure of WHO and what is the function of WHO. Then these are some of the national health agencies I have written, like UNICEF, UNDP, UNFPA, UNESCO, UNHR, UNIDO, UNASID. Next comes the ILO and FAO and World Bank. So these are the some of the things. And for last portion, that is National Health Program, I have uploaded one video previously. In that, the minimum basics I have mentioned about all the National Health Program. So in Viva it is written, you have to know at least the date and like launched year, Note the date, actually the launched year, and the objective at least of each national health program. So that portion you can see from that thing, and the important shloka I will share on the Telegram. So here our Swastha Viva practical will be over. All the very best for your exam. Thank you guys.